I am Dr. Pramod Yashoda, Senior Interventional Cardiologist, Head of the Department of Cardiology at Yashoda Hospital, Somajiguda, Hyderabad. My specialization is interventional cardiology, that is the minimally invasive procedures to treat the heart ailments. So, when we talk about the heart diseases, it encompasses several diseases including disorders that are birth defects, that is congenital heart diseases, and then several others which we acquire during our lifetime. They are called acquired heart diseases. And the most important thing globally, and which is the number one killer of the people, is coronary artery disease, that is development of blockages in the heart arteries which leads to heart attacks or heart failure and subsequently mortality. So, what is the cause for this atherosclerotic heart disease, or otherwise called as a coronary artery disease, or the problem where the blockages will occur in the heart arteries? So, there are several causes. The most important things are which are not modifiable, that includes age and gender, these two, and also one more important thing is family history. So, if someone in the family has suffered a heart attack at a young age of say less than 40 or 50 years, the chances of the progeny developing a heart attack at a similar age is 2 to 12 times more. So, this is one important thing which we have to understand, and there are several other factors which are called modifiable factors, that includes our lifestyle problems, that is high blood pressure, high sugar, high cholesterol, obesity, sedentary lifestyle, not doing any physical activity, just sitting and doing your work, smoking, and sometimes certain recreational drugs. So, all these things cause development of blockages, and fundamental to this is control of the risk factors. So, the idea of these campaigns is to create an awareness about the risk factors which lead to the heart attacks and all the problems. So, everyone should understand these risk factors, because you cannot just know whether you are a hypertensive or a diabetic or you have a high cholesterol. For that, what you should do? You should visit a hospital or a clinic and then get some investigations. They are all simple investigations which do not cost much, but they will give you an awareness of your problems and how to deal with them. And many people also have a wrong concept that if you go to a cardiologist or a physician, they will do a lot of investigations and they will confine you to a lot of drug therapies and many procedures, which is not true. Ultimately, the goal is to prevent these problems, and therefore, if you control your diabetes, or if you control your hypertension, or if you control your cholesterol, then avoid smoking, then acquire a healthy habit like doing a regular exercise, then eating habits, if you change those things, definitely it will help you a long way in beating this coronary artery disease. So, having set the context for the development of these blockages, and also once you know through the tests how to prevent it, important question comes. One may ask me, how do I know whether I have a blockage in my heart arteries or not? For that, there are some preliminary investigations which are performed. For example, a treadmill test, an exercise test that is done in the presence of a physician or a cardiologist in a hospital setting, then that will be an indirect suggestion that you may have blockages. Then similarly, we have other tests like a stress echocardiography or a nuclear study. These things will tell us whether there is a likelihood of having blockages, but it is not all the accurate tests. The most accurate tests happen to be coronary angiography. So, if someone has got a abnormal test, either treadmill test or a nuclear test or a stress echocardiography, or if he has got a multiple risk factors which I have enumerated a while ago, those people need to go for a angiography. In angiography also there are two kinds of angiograms. One is a non-invasive angiogram which is called CT coronary angiogram, which is done on an outpatient basis. It only takes 8 seconds to complete the test, and the computer will acquire the images and it will display any blockages are there. The percentage accuracy also is quite good. The second thing is called gold standard, that is the coronary angiography, which as a cardiologist we perform in the cath lab either through the radial artery or through the groin, that is the femoral artery, and that is the gold standard. The advantage of a standard coronary angiography which is done by the cardiologist is we can modify the angles of the camera and accurately assess the lesion significance, and if required we can go ahead and put the stent immediately and clear the blockage. So, by doing this definitely we are preventing the heart attacks, we are preventing the future heart failures, above all we are preventing the sudden cardiac deaths. So, this is a standard practice and there are several guidelines how to go about this from the professional bodies like a American Heart Association or a European Heart Association. It is all evidence based practice that is performed. Nowadays in our country we see that a lot of young people are coming with heart attacks, and many times we hear that one bank manager or an IT employee suddenly he complained of chest pain, before he could reach the hospital he was no more. These kind of unfortunate stories we hear. The reason for this is number one, lack of awareness, and second, particular group of people who are working in a highly stressful jobs, they have a higher risk of developing the cardiac problems. Moreover, during the COVID time we have seen that many people are homebound, they are working from home, and the eating habits have changed, there is no physical activity. Added to that, there is a lot of stress of the work that is occurring, and suddenly once the COVID restrictions are released, these people started coming out into the public, they started doing more physical activity or an exercise, and because the last few years or a couple of years they were sedentary, all of a sudden when you come into activity, that may produce what is called a plaque rupture in the blockages, that may lead to heart attacks. And definitely in our experience we are seeing now more number of people coming back with the cardiac problems after COVID. Secondly, the COVID also produced some changes in the body, and it produced a lot of clotting factors inside the body, and because of that also we are seeing more and more number of people coming to us with the heart attacks and other cardiac problems. Now, the idea of doing these kind of lectures or write-ups in the newspapers etc. or magazines, what we do as cardiologists is to serve the society by giving a direction to the people. So, as I already mentioned in the prelude, the risk factor control is the most important thing, and second step is to do a early identification before something happens. So, if you get a test done, if it is abnormal, then an angiography is done which shows about 20 or 30% block, you are on a safe ground, because we know that you have no significant problem, but the problem is there, and then we advise some medications. For example, we have a standard drugs like a statins which reduce the cholesterol burden in the blood and also in the plaques that have accumulated in the heart arteries, and we also have antiplatelet drugs, the so called blood thinners, which definitely will help to prevent major heart attacks from occurring. And a periodic surveillance is also very important. Once you know that there is a 20% or a 30% block, we advise you to take aspirin or a clopidogrel or other blood thinner and statins, and you have to follow regularly with the physician or a cardiologist to see that the blockage does not progress. So, more important is a healthy lifestyle also in addition to the medication that we give, and with this a rapid progression can be definitely avoided. So, what you are likely to get over a period of 5 years by adopting the healthy lifestyle and having a regular consultation with the physician or a cardiologist, you are postponing it by a decade or more. So, this is what we see in our practice. We have several patients on our follow up who have been diagnosed with mild blockages and who are continuing to have a healthy life by following medication and also the healthy lifestyle. Now, often when I give talks, the people ask a question, how do we know whether it is a cardiac pain or some other problem? So, this is definitely an important question, and some awareness should be created in the public. A cardiac pain occurs in the center of the chest and it spreads most commonly to the left hand, or sometimes it can spread to the right hand, or it can go to the epigastrium, that is the stomach, or both the jaws, or sometimes to the back. So, this definitely is an important symptom which occurs in circumstances where you are doing a physical activity, for example, walking briskly, or when you are doing a morning jogging, or going upstairs while you are taking stairs, or carrying some heavy weights. This discomfort will occur and it will spread to the arm, and as you stop doing that activity, gradually it will subside. So, this has a crescendo and then decrescendo pattern. It increases and gradually subsides with rest, and usually the duration is very important. It lasts between 5 to 10 minutes. It may be associated with symptoms like a sweating, giddiness, or sometimes a shortness of breath. So, invariably the person who is experiencing this kind of discomfort need to stop what he is doing. So, that is the most important thing, and it subsides within 5 to 10 minutes. So, this is the classical pattern which we see. If this kind of symptom occurs, you should not ignore. If you ignore this, you are in trouble. Generally it comes by effort or by emotional stress as well, but sometimes if it is ignored, it can occur at rest, and sometimes it can occur after food, and many times if it occurs after food, it is construed as some gastric problem, and unfortunately people consume some antacid or a Gelusil or Eno and those things as a temporary measure, but subsequently it may increase in intensity, and if you go to a doctor, an ECG is done which will confirm that it is not a gastric problem, but it is a heart attack. So, a treatment definitely will vary. So, these symptoms are very important. Any discomfort that lasts more than 20 minutes and associated with significant increase in the discomfort, profuse sweating as if someone has come out of a shower, that kind of symptom if it happens, definitely you should suspect that it is a heart attack, and an immediate therapy is required. So, the therapy is also now standardized. You have to immediately give the patient an aspirin, an ECG is to be done to confirm, and go to the nearest hospital which has the facility to treat these kind of problems. So, in this kind of situation there are two methods only to treat. One is to give a clot buster, that is called a thrombolytic therapy, which is given in the form of an injection, and the second and the most standard technique world over is what is called primary angioplasty. So, the patient is taken to cath lab, and then immediately angiography is performed through the radial artery which I have mentioned or from the femoral, and the block is identified and a stent is implanted. This is going to save the life and also save the heart muscle. If it is not done in the earliest part, maybe the 6 hours or a 12 hours period, it is going to cause damage to the heart. This damage is going to cause more problems in future, leading to heart failure or sometimes rhythm problems and then heart attack. The cost of treatment is also going to be more if the person crosses or misses this initial golden period. So, this is very important. So, never ignore these symptoms and do not try to self diagnose, and always take an appropriate opinion, and then sometimes even the media things like WhatsApp, other things are also helpful. Many times we get those ECGs from our doctors who are in doubt, and immediately we tell them that okay, this is an evolving heart attack, do not ignore, send the patient to the nearest hospital, and how a life can be saved. And one more important point I want to tell you, any patient with a heart attack, they have half of them will not be able to reach the hospital. The mortality is 50%, not only in our country, even in advanced countries like a USA or Europe, 50% of them do not reach the hospital. Of those who reach the hospital, again the mortality in the first 1 month is about 10%. So, therefore, it is a important problem, and in our country especially, as we have discussed, younger and younger people are coming due to various reasons, lack of knowledge or because of the busy schedules or because of the stress in the life, the disease burden is more. So, never ignore these things and keep your heart safe. That is very, very important thing. And we are going to have on 29th September the World Heart Day, and this time they have chosen a theme, harnessing the power of digital communication to create an awareness and prevention and management of cardiovascular disease, and use your heart to connect with the heart. That is the theme they have proposed. So, let us all work together to beat this cardiovascular disease.